may take a second for it to load. Okay, so the last topic of education that I have researched over, possibly to put in a group session, is over home environment modifications. So really just to reduce the risk of falls in the home. I thought this little graphic was really good, but I'll just kind of go through some of the more common things that are, I guess, well known, well talked about with patients. So with rugs, removing them, huge tripping hazard, removing cords or taping them down, decluttering, using a lot of light. So maybe if you're going to turn all your lights off, using a night light in the hallways and stuff, just so if you need to go to the restroom or get up or anything like that. And moving on. So seated kickboxing, I've done this one a couple times and it's been really, really fun and the patients have enjoyed it. I actually made the program, typed it out and everything for my CI out of this one. So that's why in the benefits, some things are in all caps, just so when she's going over it with patients, she can really emphasize the things that are considered benefits of kickboxing. So it improves cardiovascular health, increases stamina and endurance, reduces stress by relieving physical and mental tension, develops core stability through weight shifting, which improves or maintains balance, increases total body strength, and then improves hand-eye coordination. So the different moves that we've done: forward punch, crossbody punch, the hook, uppercut. To get our legs involved more, we'll do side steps or forward kicks. And then for higher level patients, you can add in combos. So you can either do like side steps or forward kicks with a punch, or you can do a combo of punches, so like forward, hook, uppercut, and then they have to keep it in mind and remember it. So it also gets that cognition going. Leisure pursuits, these kind of tap into the psychosocial aspect of OT a little more, which I really love. The main thing we've done with leisure, other than, like I said, the bean bags, is the coloring and drawing. So we've done positive, negative hands. So the patients will trace their hands on a piece of paper, and then they write a goal. So the right hand is for the supports or the things that are helping reach the goal, and then the left hand is for the barriers or the things that are getting in the way. And then usually we go around the room and we say like one or two of each. And so it's a really good time for patients to kind of get into discussion and conversation with others and just really learn from one another and, help each other out through this tough time. And then we also if they want to color or draw pictures to represent what they're writing, they can do that on the hands. And the next one we haven't done, but I have researched it a little bit, so it's the Tree of Strength. And it's a thing that's done in therapy or with patients, so this is kind of what it looks like. I have the link on the references, but they trace their hand and then they add branches, and then each of the branches they fill the leaves with things that help them get through a difficult time, which lost change in function, maybe a stroke, amputee, things like that. That's a difficult time. And these can be personal strengths, coping strategies, enjoyable activities, and then supportive people in your life. So overall for coping strategies, guided imagery and positive affirmations. So for guided imagery, it's the harmony between the mind and the body, which is really something big for occupational therapy. It is a focused imagination and it elicits a mental escape, so to speak. And it promotes healing, relaxation, which can lower blood pressure, and then it can help to manage pain. And then another one, positive affirmations. So I haven't done a full group on positive affirmations, but I do like to use it like at the end of groups or something, maybe at the beginning, or just really overall in general patients. Day-to-day individual sessions. So they help to challenge and overcome negative feelings and thoughts, which are really common to have when someone's sick or they have a change in function. And then here are some examples. I know I can accomplish anything I set my mind to. I will work towards my goal today, and I am improving each day. So just to kind of go through this, I did a whole 1.5 hour session with a patient who was super self-limiting. And it was strictly progressive muscle relaxation to help with pain, breathing techniques, guided imagery, positive affirmations, power of positivity. I did all of that. That's all I did. Because she was really self-limiting, and that's the kind of things that she needed to kind of overcome that and allow herself to really start progressing in therapy. So like I said, I think it's really powerful, and I use it a lot with patients. We even have these cards that have them positive affirmations on them, and we let patients pick, and then we'll leave them in their room and they can take them. And so like if they're feeling down, or every morning when they wake up, they can tell themselves the things that they loved so much about those cards and the things that are helping them. So how I've applied this new knowledge, I've set a goal for myself to do the more typical group sessions 3 times a week, and then adding in these more creative ideas 2 times a week. Like I said earlier, the kickboxing class has been a huge hit with patients. I've only done it twice, but it's already a new favorite, and it's already changing and becoming better. So it's really been fun. I've used my knowledge on guided imagery and the power of positivity with all of my patients, not just in group sessions. So I was kind of going through that earlier. I truly do believe that it's a powerful avenue for patients, and it can really help them progress in therapy. Your mind is a huge part of you, so it's important to remember that with patients. And then lastly, I've implemented the knowledge from my research on energy conservation and safety education to provide education to my patients at all times throughout the day. So I've kind of made those, instead of doing a full-on group session, I've kind of just made it like an ongoing learning and daily thing with my patients. I just feel like it's worked better, and based on the groups I've had, these other ideas have been more suitable to them. And then lastly, my personal growth and change. So I really have felt like I've grown and changed during this level 2 fieldwork. So just a few things. My ability to be creative has greatly improved. I was actually kind of worried at times as an OT student, like, man, am I creative enough for this? And most OTs I know are super creative, and I just felt like I maybe wasn't getting there. But being pushed and challenged to do it really has helped me. I've grown in my ability to think on my feet when in group sessions, also in individual sessions. Maybe they don't go as planned, or group members change. Maybe they're moody. That's super common, and they just don't want to do what you had planned. So that's really important, I think. I feel more confident in my skills as an occupational therapist overall, and then I feel more confident in my abilities to lead group sessions as well. And going along with that, I am enjoying the group sessions more instead of being super nervous about what to do and how to pass the time. 30 minutes didn't seem that long, but my first couple of times that I led a group session, I was like, oh, is there lulls? Is it boring? Are they liking it? What is my CI thinking? So it was just kind of a little nerve-wracking. So I've gotten a lot more comfortable with that, which leads me to my last one. I've noticed a huge change in my level of comfort in front of others, mainly my CI. She asked me what I'm going to do in group today, and I say, this is it. And I write the notes, and I lead it, and everything goes, as planned as it can be. And if things don't go as planned, I'm able to switch it up and adapt. And so I've felt really improved in that area. And then as well, just in that way, I feel more comfortable with other therapists and the patients themselves, because they're my patients, but I'm still essentially performing for them, showing them my skills as well. So, and they need to feel that you're doing what you should be doing and that you're helping them and everything. So you need to show them that you are capable of doing that. So that is my project for level 2 at Encompass Health.